22 years old rugby player falls onto a outstretched hand and sustains a fracture to distal radius. The X-ray shows dorsally angulated comminuted fracture. What is the most appropriate management? So here, first of all, the fracture occurs in the distal radius, and the second one, it is the comminuted fracture. That means the fracture segment is more than 2. So in case of more than 2 fracture, there is the conservative treatment most of the time fails, or when it joined again, when union occurs, usually malunion occurs or distorted union occurs. So what is maybe the appropriate management in this patient? Here the options are: reduce under hematoma block and place a plaster, admit for open reduction and internal fixation, reduce using Bayer's block and plate into plaster cast and place into plaster cast, discharge home and sealing and review for the fracture clinic, discharge home with futura splint and fracture clinic for the appointment. But here we have to keep in mind that there is distal radius fracture and comminuted fracture. That means the fracture segment is more than 2. So it is very dangerous condition. That means when fracture segment is more than 2, in this condition the reunion or union is very difficult. So what can we do? Unlike an osteoporotic fracture, elderly lady, in case of the high velocity injury, usually they require surgical fixation. So it is the most important point that this surgical fixation is always required when there is high velocity injury and when the fracture segment is more than 2, because here the non-union or malunion chance is more. So what can we do in case of comminuted fracture? In case of comminuted fracture, what can we do? Which is the open reduction and internal fixation. It is the best option. Other option here, such as the plaster usually cannot reposition the fracture, and Bayer's block can into plaster cast also the same action. There is no chance of discharge home, because here this is a community fracture, that means the multiple fracture. So we have to admit the patient and I have to go the operation, which is the open reduction and